Can your genes increase your bladder cancer risk? Imagine that your genes could influence your chances of developing bladder cancer. While lifestyle choices and environmental exposures play a big role, genetics also contribute in subtle but important ways. Bladder cancer is a complex disease caused by a mix of factors, and your genes are part of that puzzle. Scientists have found that bladder cancer is a polygenic disease, meaning many genes work together to influence risk. These genes don't cause cancer on their own but can make you more susceptible. For example, certain genetic variants identified through genome-wide studies are linked to increased risk, especially in genes involved in how your body processes toxins, repairs DNA, or controls cell growth. Genes like NAT2 and GSTM1 are known to affect how your body metabolizes harmful chemicals, which can influence bladder cancer risk. If your body is less efficient at detoxifying carcinogens, your risk might be slightly higher. Some hereditary syndromes, like Lynch syndrome, can also increase the chance of bladder cancer. Lynch syndrome is mainly associated with colon and endometrial cancers, but can also raise risks for other cancers, including those in the urinary tract. Family history is another important factor. If close relatives have had bladder cancer, your own risk could be higher due to shared genes or similar environmental exposures. However, it's important to remember that genetic predisposition usually accounts for a smaller part of the overall risk compared to environmental factors like smoking or exposure to certain chemicals. Genetic testing can sometimes identify inherited risks, but it is not routinely used for bladder cancer screening. If you have a strong family history, talking to a genetic counselor might help you understand your personal risk better. Still, reducing known environmental risks remains the most effective way to lower your chances of developing bladder cancer. Quitting smoking, avoiding exposure to harmful chemicals, and maintaining good bladder health through lifestyle choices are key steps. So, while your genes can influence your risk, they are just one piece of the puzzle. Being aware of your family history and making healthy choices can help you take control of your bladder health. Always consult healthcare professionals for personalized advice and screening options.